We're glad
Hi.
to see you. It's a pleasure to have you too. You know, there are some common foot problems that plague us all year round. This is the summertime. The weather's warmed up. People are going out to the beach. They're going barefoot. They're wearing flip-flops. They're wearing sandals. But you know what? Be careful, because you see them spraying the sunscreen on their body a lot of times, but they're forgetting about their feet. Podiatrist Dr. Ira Kraus joins us now, and we were always glad to see her. You know, you were talking about, it's a lot of times people think about things simple things.
Right.
You're seeing that in your office because of foot problems like flip-flops. I mean, a lot of us wear flip-flops in the summer. I do it all the time.
We see so many injuries from flip-flops. You know, if you step on glass or you step on a rock or a branch is in the ground, it goes right through the flip-flops into the foot. We see ankle sprains, lack of non-stability. You know, I'll tell you something that you may think is crazy, but just last week, one of my partners had to take a young boy to the operating room for an abscess because he stepped on a rock and didn't tell his parents. Wow. And it got infected in his shoes, and finally, and it was 1 month before he said something. So
wow, really.
Yeah, and not diabetic, not a patient who's predisposed to having a problem, but just an everyday, you know, kids don't tell their parents anything.
Yeah.
So that's where, especially where they get splinters and they get glass in their feet. I mean, these are things we're seeing every day. They're walking around barefoot on the tar, their feet are getting burned on the bottom. I mean, it's amazing what you see.
That's some really common things. Let's put the rest of those up on the screens and kind of talk about that. And when you talk about burn, you're talking about, in some cases, third-degree burns.
People
on your
get,
feet.
because you lie out in the sun, you put the suntan lotion on your legs, you put it on your body, you don't put it on the tops of your foot. You know how many times I see people come in and their tops of their foot are just blistered over. You know, I mean, they just don't take care of themselves.
That's not something you think to put sunscreen
No,
on.
you don't think about it. You're covering up the rest of your body, and you leave the tops of your feet open and your toes. And I have people that come in with red infections, blisters. It's amazing.
And one of the other things, you're talking about dry feet there, dry skin, and it's like a lot of times you're talking about, because for women, a lot of times when we're dressed up, we wear the really high heel sandals with their backs out, and then also, or the flip-flops. And you're saying a lot of times people aren't getting their heels. And so that's
you get calluses.
Right, calluses on there.
They need to practice prevention, skin lotion, moisturizing their skin, even using a pumice stone or a skin file on it. But you're right, you see all these buildup of dry skin just because of the shoe gear that we're wearing this time of year.
Yeah, a lot of times I know I put like the extra, like the toe heel cream on there during every morning though. Well, you know, some good advice. Take care of your feet in the summer. That's what we want people to remember. So,
It's prevention.
All right, all about prevention. Ira, great to see you as always.